In Australian history, Aboriginal and Torres Strait Islander people have been treated quite poorly. Some were taken away from their families and became part of what is now known as the Stolen Generation. And further back in history, the colonizers came over and took over the native Australian land. These actions still leave a mark on Aboriginal and Torres Strait Islander people today. So, how does this relate to our topic of Indigenous women's health? Well, due to these horrible occurrences in history, Aboriginal and Torres Strait Islander people still feel the discrimination in different ways. There are many health disparities between Aboriginal and Torres Strait Islander women and non-Indigenous Australian women. Much of this gap in the way healthcare is given is due to trying to avoid discrimination, or can be due to rural living where it is hard to access proper care. Topic of maternal health. Aboriginal and Torres Strait Islander people are at a higher risk of having negative outcomes with their pregnancy. A report from the Australian Institute of Health and Welfare in 2015 found that 45% of Indigenous mothers smoked during pregnancy, compared with 12% of non-Indigenous mothers. The report also found that 11.8% of babies with Indigenous mothers were low birth weight, twice as high as babies of non-Indigenous mothers. Another statistic from the Department of Health stated that Indigenous babies had a higher rate of fetal death, which is 11.7 per 1,000 births compared with 7.2 per 1,000 non-Indigenous births. Although these are negative statistics, there are initiatives and programs being put into place to bring these numbers down for Aboriginal and Torres Strait Islander women, which Millie will speak about later in this presentation. I am also wanting to talk about domestic violence and how Aboriginal and Torres Strait Islander women are affected. A poll from the Victoria State Government found these following statistics. Aboriginal and Torres Strait Islander women are 5 times as likely to experience physical violence and 3 times as likely to experience sexual violence than other Australian women. Aboriginal and Torres Strait Islander women are 35 times more likely to be hospitalized due to family violence-related assaults than other Australian women. Aboriginal and Torres Strait Islander women are 5 times more likely to be victims of homicide than other Australian women. More than half of these homicides are related to family violence. Without intervention, the cost of violence perpetrated against Aboriginal and Torres Strait Islander women is estimated to be $2.2 billion in 2021 to 2022, including costs associated with pain, suffering, premature death, and health costs. So, what should we think about when it comes to changing these negative statistics? We can look at the social determinants of health that pertain to our topic of women's health. First is sex and gender, which in this case we can think of ways to help women escape domestic violence, as they are often the ones experiencing it. Next is the life stages, which can be taking into account where a woman is at in her life, as women's needs differ over their lifetime. Another social determinant of health is access to resources. So, in the case of Aboriginal and Torres Strait Islander women, it may be hard for them to access the proper resources they need, or they may be scared to obtain these resources due to discrimination, which leads us to our last social determinant of health, diversity. As I just mentioned, there can be marginalization and discrimination against diverse women, which affects their access to resources, and therefore can impact their health and well-being.
For the purpose of this report, let us focus on how the National Women's Health Policy of 2010 addresses women's health and well-being by adopting a policy that promotes equality through maintaining and developing health services and prevention programs to treat and avoid disease through targeting health issues that will have the greatest impact over the next 2 decades, and aiming to address health inequities through broader reforms addressing the social determinants of health. Policies on domestic violence. Ex-Prime Minister Malcolm Turnbull sees to it that Australians would realize that he takes violence against women and children seriously. As such, in 2016, he released $25 million worth plan known as the Third Action Plan to specifically help Aboriginal and Torres Strait Islander women and children to fight violence. The plan would cover trauma-informed therapeutic services for Indigenous children affected by family violence to break the cycle of intergenerational violence, services for perpetrators to encourage behavior change and prevent future offending, and intensive family-focused case management to address drivers and behaviors that lead to family violence. Another thorough policy conducted includes Time for Action, the National Council's plan for Australia to reduce violence against women and their children 2009 to 2021. The key message therefore to government is that it is time for action too. bring forward the new era of federalism through government uplifting their performance to break through entrenched patterns of violence against women and their children, repairing the fragmentation and inconsistency across the service system, and demonstrating leadership on the international stage in achieving the goals of the UN Convention on the elimination of all forms of violence against women. Enhance the role of the community sector in preventing violence against women and their children through realistic and sustained funding for services and an investment in skilling and supporting the workforce to achieve holistic response to the complex of needs of women and their children who are victims of violence. Close the gap. Maternal health. The maternal health of Aboriginal and Torres Strait Islander women is one of the highlights of the Close the Gap framework established by the Australian government. The plan is the answer to the health risk which Aboriginal and Torres Strait Islander women face: maternal smoking, alcohol and other drug consumption, inadequate nutrition, stress, illness and infection, drinking alcohol resulting to cognitive, social and emotional dysfunction over the child's lifetime, otherwise known as the fetal alcohol spectrum disorder.
It is vital that there are culturally safe services to address the priorities such as domestic violence and access to maternity services. When accessing services and reporting violence, all women fear shame, ostracism and reprisal. However, Aboriginal and Torres Strait Islander women have additional fears deeply rooted in history. There is a need to develop strong trust relationships with Aboriginal and Torres Strait Islander communities. Evidence suggests services and programs are much more likely to be effective if local Aboriginal and Torres Strait Islanders are involved in their development and implementation. Currently, there is a lack of Indigenous-run programs targeting domestic violence. Another critique of current services is a lack of early intervention. Most services and resources are directed to crisis point of situations, rather than intervening before a situation is dire. Also, many services focus on providing services for women, rather than intervening and counselling men who are most often the perpetrators of violence. A good example of a current culturally safe service is Relationships Australia. This program employs Aboriginal and Torres Strait Islander workforce, and all employees undergo culturally safe training. They engage with Aboriginal community and leaders to respond to their needs. They also run workshops for men in order to prevent violence before it occurs. A major critique of current maternity services is its inflexibility and its adoption of Western health ideals. This promotes hierarchy and power struggles and denies the social and emotional and spiritual aspects of Indigenous health. 3 adaptations need to be addressed to improve maternity services for women. These include increasing Indigenous workforce, providing culturally safe services, and developing birthing on country services. An example of an effective service is the Cape York Health Council's Baby Basket program. The program aims to support women who are expecting or have recently given birth. 3 baby baskets are delivered to women throughout their pregnancy. These baskets contain food vouchers, education on healthy life choices concerning smoking cessation, diet, and alcohol consumption. Key recommendations for ATSICHS Brisbane to improve the overall health of Aboriginal and Torres Strait Islander women is to focus on reducing major barriers to women's health. These include addressing priority areas such as the high levels of domestic violence against Indigenous women and improving maternity services. Key approaches to improving these services include increasing and supporting Indigenous health workers, improving the cultural safety of services, flexibility and acknowledgement of holistic definitions of health, recognition of Indigenous women's journey and great strengths.